In order to learn the interior of base of the skull, we have to cut the skull and we have to remove the vault, cranial vault, and we have to cut horizontally and we have to expose the cranial fossae. The interior of the base of the skull can be divided into three parts: anterior part, the middle part, and the posterior deeper part. These are called as cranial fossae. The anterior part is called as anterior cranial fossa, the middle part is called as middle cranial fossa, and the posterior part is called as posterior cranial fossa respectively. So the features of all these three cranial fossae we are supposed to go through. Anterior cranial fossa is the anteriormost part. The bones seen here are: in the midline we have the Cribriform plate of ethmoid, and on either side we have the orbital plate of frontal bone. So this is the region of the frontal bone, and from frontal bone we have the orbital plate. This will form the roof of the orbit. So anteriorly we have the bony orbit. Its roof is formed by the orbital plate of frontal bone. And again, still more behind the Cribriform plate of ethmoid, we have the jugum sphenoidae. The Cribriform plate of ethmoid forms the roof for the nasal cavity, and there we can appreciate the tiny sieve-like openings. These openings are for the passage of the olfactory nerve rootlets. And again we have a midline elevation here called as crista galli, and this crista galli provides attachment to the anterior end of falx cerebri. Just anterior to the crista galli we can appreciate a foramen here. This foramen is called as foramen cecum, and through this foramen cecum occasionally emissary vein passes to the nasal cavity. On either side of the crista galli we can appreciate the anterior and posterior ethmoidal canals, and these are for the passage of anterior and posterior ethmoidal nerves and vessels. So next part is the orbital plate of frontal bone. So as I mentioned earlier, this orbital plate of frontal bone forms the roof for the orbital cavity. And behind this orbital plate of frontal bone articulates with the lesser wing of sphenoid. So this part is the lesser wing of sphenoid. The medial end of the lesser wing of sphenoid, the posterior margin of lesser wing of sphenoid, forms the anterior clenoid process. So here this is anterior clenoid process. This anterior clenoid process provides attachment to the anterior end of free margin of tentorium cerebelli.